Okay, so this is another episode of Dr. Joel's Knowledge Bombs, Knowledge Nuggets, things I talk to my patients about a lot, okay? So this is another thing that we hear a lot of. My doctor told me to stop. And we use doctor because that's just the broad term, I guess, for healthcare providers. It could be a doctor, an MD, could be a massage therapist, could be a chiropractor, could be a physical therapist, hopefully not. And so the one we hear a lot of, right, is with running, right? Like running's bad for your knees, so you should stop. Or maybe squatting, deadlifting, any lifting heavy weights in general, anything like that. A lot of times patients will come in and some sort of healthcare provider, someone they trust, has told them that this is bad for them. So let's give these people the benefit of the doubt a little bit, right? Let's even take running for example. Let's say running does put some stress on your knees, and to be frank with you, it does, right? Like a little bit, right? Like your knee joints will actually have, for most people, a little more wear on them if you run a lot than as if you didn't. So, but what is the alternative? So that's what I always ask. So let's say it is a little worse for your joints. Maybe you'll have some knee pain from time to time. Maybe later in life, if you decided to be a runner instead of a swimmer, you might be getting a knee replacement or something like that. But let's say because of that, you stop running, okay? What then is your health like if you stop doing the things that you're told are bad for you, right? So if you stop running, let's say, one, you'll get some cardiovascular disease, which is a huge problem. You'll gain some weight. You'll have, you won't have the ability for a lot of people just mentally to decrease some stress in their lives. It's kind of like an escape to go out and run. You don't burn off adrenaline, so you don't sleep as well. And not sleeping, that has a lot of effects. A lot of times when people are involved in exercise, that tends to affect other parts of their lives, and they will eat healthier because they want to be able to fuel their sport or their activity even better. So it's really ironic when when we hear somebody say like, don't do this because it's maybe have a little bit of a detrimental effect to one single part of your body, wherein not doing that will affect your overall health altogether. So we really try to be honest with people and explain that to them and be like, okay, yeah, so being more active, the chances are that you may have some aches and pains here and there, right? But that's where we step in, right? Because we help you with those aches and pains. We want to make sure that you can continue to do exercise and activity for as long as you possibly can. And that's where we come up with the term that's really popular, is how can we help people be an athlete for life, right? And really having a movement plan for as long as you can. So as people age, honestly, there will be some detrimental effects, right? Like our bodies do age. And so we are always trying to find a plan for everybody that allows them to do as much as they can for as long as they can. That's always the plan, and that's where we look to take people. So if you have a healthcare provider, quote unquote doctor, telling you to stop doing that because it's bad for maybe one little part of your body or may cause some pain side to side, the opposite end of that spectrum, it's far worse for you overall if you stop doing those things because it affects your overall health. So if you have any input or any questions or any comments about this, we'd be happy to hear them. And hopefully you are someone who has a movement plan and you're planning on being an athlete for life. If you have been told to stop doing something and you're like, I think I actually could really be doing that and you need some help, that's where we can help you out. So don't stop, keep going. I'll talk to you guys again soon.